I had upper eyelid surgery August 2015 with a terrible outcome. Can this be corrected? I had corrective surgery by another reputable surgeon in October, but unfortunately, the result was not as expected. My surgeon suggests another surgery. I am so very worried about whether I will ever have my normal eyes again. The shape has changed, there is severe tethering where the eyelid was stitched, and I have a great number of wrinkles I never had. The eyelids pull and drag constantly. There is a pinching sensation on the left eyelid, a pulling on the right. My eyes burn. Can this be corrected?
Thank you for your question. You stated in your question that you had surgery in August of 2015 that you were unhappy with, and that you underwent revision surgery in October by another surgeon. And now you're concerned about the outcome of that surgery, where you feel you have some tethering, some bumps and irregularities, and you don't like the appearance and the shape of your eyes. Well, certainly I can give you some guidance as to what you're going through. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I practice in Manhattan and Long Island for over 20 years, and revision eyelid surgery is something I perform for patients who come from around the world with various issues similar to yourself. So, without knowing all of the full details of your appearance prior to the first surgery and what resulted after the surgery in August, but I can certainly see from the photos that your concerns are reasonable. I think that one thing that you have to at least understand is that eyelid surgery, of course, is much more complicated than a lot of doctors make it to be. There's a lot of delicate tissue, and there's a lot of areas where a lot things can require a certain amount of finesse, knowledge, experience, which is why there is a specialty called oculofacial, plastic, and reconstructive surgery. I can imagine someone who's trained first in eye surgery and then specializes in eyelid surgery for 2 years of fellowship after training in eye surgery first. So with that being understood, there are things that you do based on wound healing. And wound healing is a process that goes on for a year and even beyond. The question that has to be asked is, why do things look the way they do? And this is the question that should be brought to the revision doctor. And if the doctor already feels that there is an indication for additional surgery, the timing is important. In my opinion, whenever a surgery is done, there are certain hard indications where you definitely need to move in sooner rather than later. And then there's certain times when there is a room to wait. But what I like to do is, if there's a surgery that needs revision and it's within a few months of the previous surgery, to me the 3 to 6 month point can sometimes be the optimal point, because at the 3 month point there's less swelling, and before the 6 month point when there's more long-term, more well-developed scar tissue. Now, that being said, you have to also ask the question to the revision doctor: why do things look the way they do? What happened? Why did this happen? And what can be done differently to avoid a recurrence of these problems? When I see patients who need revision surgery, it is very common for them to have had at least 5 operations before coming to see me. A lot of times doctors do things that are well intended, but sometimes they don't do procedures that are necessary to get the desired outcome. There's too many possible options to discuss in detail in answering this question in this way. But what I think it's important to understand is talk to your doctor who did the revision surgery about what specific outcomes you want to see happen. You mentioned the shape, and that's a very, very important part of the aesthetics of the eyes. People come to me will say when their lower eyelids, for example, are rounded, they'll feel like they lost the character of their eyes. They don't look like themselves. And if this is a problem for you, make sure you express this to the doctor who performed the revision surgery, and be comfortable in and confident in their ability to deliver the results. The question I would ask is, did the eyes look pretty good after the revision surgery? And is what you're experiencing now just the result of the way the eyes are healing? It's a kind of a golden rule in cosmetic surgery, is that if it doesn't look good in the operating room, it's not going to look good outside the operating room. So I think that this is you have opportunity to discuss further the options and what can happen. And if you aren't comfortable and confident with the doctor who performed the revision surgery, then additional opinions can be sought out. But it's also important to understand that when you meet different doctors, you will get many different opinions. Clinical medicine is like that. There isn't a simple formula to everything, and every surgeon and every physician brings to the table not only knowledge from training, but also knowledge from hands-on experience. And that's why where someone like myself who's 20 years in practice performing hundreds and hundreds of surgeries every year, there's a certain level of experience the aggregate of over 20 years. And I try to communicate that experience to my patients and help them understand the predictability and the things that can go in one direction or another direction depending on how they heal. Monitoring healing is also very important. It's something that we do. We also use a lot of regenerative technology where we use wound healing materials such as acellular matrix and platelet-rich plasma to optimize the results of our wound healing, because a lot of times when people have revision eyelid surgery, they have a lot of scar tissue. And a lot of times when you operate on scar tissue, it may look good in the beginning, but it may result in more scar tissue. And that in itself has its own method of management. So again, in summary, you want to talk to your doctor about getting the result in terms of the shape and the details of what can be done differently to avoid the problems you're dealing with currently. So I hope that was helpful. I wish you the best of luck. And thank you for your question.